Hello, my name is Tabitha Gownlin, and I'm doing my persuasive action speech today. And I, first of all, want to show my card. Card number 1, card number 2, and my works cited. And I'd like to introduce my audience member. There's Rachel. There's Ted, number 2. Susan, number 3. Eddie, number 4. And Bryn, number 5. All right. First of all, I'd like to know from my audience, is anybody in here an organ donor?
Yep.
Yes.
Good. Got a couple hands. That's good. All right. Today I want to try to convince you to become all that you can be when it comes to organ donating. All right. First, I'd like to talk to you about the inner organs and what they can do for a person in a transplant. The heart can be transplanted. There's many people that have heart disease that need new hearts, and if they've been donated, they can transplant the heart, and they can live for many years on the donated heart. There's also lungs that can be, which they're the hardest thing to probably donate and to actually live the longest. But there are many out there that have from smoking. There's emphysema. There's also lung cancer that would require a new lung. There are the eyes. Probably 30 miles away from here is a Lion's Eye Bank, and I've had the privilege of touring that at one time. And you see all these jars full of chemicals with eyeballs looking back at you. But the eyeball is just a little bit smaller than your fist. So what you see as your eyeball is just merely the outer part. There's more to the eyeball in the back. There's the pupil, the cornea, the retina, the many things that can be taken and helped for an eye transplant to make someone that's never been able to see, who's been blind all their lives, be able to get sight. There's kidneys that can be transplanted. You can live with just one kidney. So one can be donated while you're a live donor to help someone who's had kidney failure, renal failure. There's also liver that can be taken from a live donor, and that is something that regenerates as long as you've got the right blood type. And this is with all the transplants, you have to have a matching blood type. But it can be cut from your liver and taken and attached to a donor, and then it can grow, and they can use their liver again. There are also the outer layers that can be donated. Of course, when you're, even if you're alive and you're a burn victim, there can be skin taken from other areas to put on the burn spot. But especially if someone has passed on and donated skin, it can go to someone who's had first degree, second degree, third degree burns over any part of their body that can regrow skin by the donation of just skin. There's also muscles that can be used, and there's tissues, and there's also hair. Hair can be replanted to your own or to others, but it can also be in the form of like a lady with long hair or a little girl with long hair that grows it over a 1.5 feet long and gets it cut off, can be donated to Locks of Love, especially for those that have lost their hair to cancer or radiation, and they can get a wig with real hair, and they can redeem something that they've lost. There are platelets that can be donated several times. It doesn't have to be a one-time donation, and then blood can be donated quite often. And I think you can do it every probably 10 days. I might be a little bit off on that. But, I mean, you can donate blood quite a bit. Cells can be donated as well as bone marrow. Someone that's got leukemia, if you're not a definite match to a family member, sibling, mother, father, grandparent, there are many people out there that have leukemia that need bone marrow donors to get rid of the leukemia. Then there's the donation of a body. Bodies, such as the cadaver, can donate up to 50 body items to save lives. And there is also cadavers can be used in the medical field where doctors and nurses can kind of do autopsies, kind of dig in there and see what organs look like, especially after they've had smoke or inhalation or if there's been Alzheimer's, they can see what's happened to the brain. But you can donate their body so that they can know how to better take care of patients, especially when they've been afflicted by some sort of disease. Let's see. In www.organdonor.gov, there's a waiting list on there, and if there's 75 people to 85 people per day that receive an organ and that saves their lives. But even though there's 75 to 85 that receive it, there are 20 that do without, and they do die without that organ. It said in 2008, 60% of all the living donors were females, but in 2010, the men's was increasing from 40 to 47%. So that is a great increase for the men. 2.5 million people died in 2007. Can you imagine if they donated one organ, how many people's lives they could have saved if they only donated one? Many people are scared about donating. Many people, wonder what's going to happen with their body afterwards. I mean, you're not there anymore. Your body's there. It can be useful. We have www.redcross.org, and on their website, they will locate a place where you can give and donate blood. You can also train to work for the Red Cross, and you can also be a volunteer. A lot of times people think that giving blood is pretty painful, but it's not much more than a prick of a needle. Of course, then comes out the blood, and you do feel a little wheezy afterwards. After a quick cookie and maybe some juice, you're back to normal. Some people pass out, but not always. There's some tragedy, but, I mean, you're given a good thing. Then we have www.biogift.com, and they will show you exactly how you can sign up to donate your body. Again, there's a big need for the science field of what they can do with the body and how they can learn from it. There are so many people that need them, and there's so many ways that you can sign up for this. Just by going to your local license bureau when you're getting your photo ID drive, they will ask you if you want to be an organ donor. On the back of your license, if you'll check, there's a barcode just like on a credit card. And once it's swiped, it'll tell whoever it is that has that if you donated one of your organs, all of your organs, or none of them at all, which is fine. But we try to increase our organ donors for the big need out there. You can volunteer at a blood drive, even if it's just handing out cookies and juice or picking someone up off the floor. You can donate platelets, and word of mouth is the biggest thing. Red Cross always accepts volunteers, and just in conclusion, there's a big need out there for organs that can save so many people's lives. And I've seen hands raised, and I know some of you have donated, and some of you are going to donate someday. And I encourage you to do more and all that you can. And I thank you for being an organ donor, and myself, I am one too. Thank you very much. Thank you for listening.